wanted to welcome you to my podcast. Soma said we shared a little fun fact offline that we both went to East Meadow High School, and you grew up in East Meadow, Long Island?
Yes, I did. I grew up in the part of Long Island of East Meadow that was right behind a jail.
Yes.
And a hospital. My backyard of the jail. So I was going to go into hospital administration or prison administration.
It's funny because I did my residency at Bellevue Hospital, and I feel like it was the same thing. There in Bellevue, there was a jail. There was a school also. There was a school also, and it had its own little community within the hospital itself. And it reminded me a lot of the area around high school. Well, it was interesting. I was wondering, why did they put a high school so close to a prison, right?
Across the street. Close. It was across the street. And there it was, yes.
Public flooding, right? Well, you are very welcome, on my podcast right now, because there's a lot happening in healthcare, right? And I feel that patients really are suffering, right? Because unless they have a family member to advocate for themselves, it's very difficult at this time to navigate what's going on. And I can share with you, without giving away too much HIPAA in terms of my family member, like last year, I was, even though I'm a doctor, I served as patient advocate for my mom. And had I not been there, I don't know what would have happened. I really don't know. And this was involving the hospital system where she was admitted twice last year. And it got me to thinking, okay, like, she has me, thankfully, but there are God knows how many people who don't. And what happens to them? I know what happens to them because I've been in the system. And so I wanted to learn from you a little bit about your background, have my listeners learn about you, and what inspired you to start being a healthcare advocate.
Okay, thank you. And I appreciate this opportunity. And I would say that in my sort of speaking rounds, this is the first time that I've gotten to speak to a doctor directly. So I'm really looking forward to this conversation because you have so much to input into the conversation about how we can help people prepare better to be engaged in their healthcare. And it is a really complicated system.
Hey everyone, big shout out to Ariel Vivleka, founder of Finally All Natural. Ariel is on a mission to educate people about hidden ingredients in skincare products. Did you know the FDA allows incidental ingredients that aren't labeled or disclosed? That's why Finally All Natural is special. They focus on how ingredients are created, excluding extracts and essential oils, and have world-first formulas that work for a variety of skin types. They've also partnered with CleanHub for eco-friendly packaging and offer an exclusive organic face oil that has been scientifically proven to boost the proteins in your skin, enhancing hydration and strengthening the skin barrier. All 100% vegan. If you're into holistic skincare or non-toxic living, Ariel is your go-to expert. Keep up the amazing work, Ariel. Get in touch with her today. All the links are in description below.
I was fortunate in many ways. I had a father who loved his job. He worked for a health insurance company. He worked there for 36 years. And when I was a teenager, he brought me home 3 brochures. One brochure was healthcare administrator. One brochure was a nutritionist. And another brochure was a human resources administrator. And based on what I was already doing in high school in terms of leading clubs and being involved in more organizational management kinds of issues, I felt like a kinship. That's where my skills were. So I went to the best college that I could go to, but I was focused on going to graduate school for healthcare administration. In fact, I had applied to a few schools and they said, you're applying to the graduate school. Because remember, back then in the 70s, there was no internet. So I was just using library resources. And I applied to schools because I thought, and why they said, no, you have to go to college first, and then you can apply here. I went to the University of Michigan, which had a great program, great professors. I'm still in touch with a lot of people. People from Michigan have made great contributions to the healthcare system. Came back to New York, where I grew up, family, friends. and started a very, diverse career. My goal was to be a hospital administrator. I worked in a hospital for 4 years, but I got an opportunity to work in consulting for a while, and I learned about reimbursement systems and financial systems. And then I got recruited to work at a hospital association, a metropolitan hospital association. And the president at the time was new to New York, but he was recruiting people. But he was from Michigan, and that's how I got that job as in a hospital association. And he said, do you want to help one hospital or do you want to help a lot of hospitals? Because that's what the hospital association. So I was there for 19 years doing many different things, learning about policy and organization and regulation and really what leadership really was in a hospital. And then after that, I did multiple things. I went back to consulting. I was an interim director of a foster care agency because they were in a leadership crisis, so I helped them out. And then I did more consulting, and then I had the opportunity to help start a managed care plan, Medicaid managed care. And I helped start that plan in terms of applying and meeting all the regulations and launching the plan. And I eventually became the executive director of a Medicaid and Medicare managed care plan. And I always looked at it was an extension of everything that I had done in terms of how to expand access to healthcare services for people, for the members of this healthcare plan who are also patients. Some of them are more both low income and elderly. And all of my previous experience really came into play in terms of creating this managed care services to bring to people to make their lives better.
I want to take a moment to give a huge shout out to Melissa Murphy-Pavone and her amazing team at Mindful Financial Partners. Melissa has over 18 years of experience as a certified financial planner and divorce financial analyst. And what truly sets her apart is how she values people over portfolios. Whether you're going through major life changes or just want to take control of your financial future, Melissa's approach is all about aligning your wealth with the life you truly want to live. She doesn't just focus on growing wealth, but also on creating balance and purpose in your financial journey. You can get in touch with her at her website, mindfulfinancialpartners.com, and you can find all the links in the description. Be sure to check it out.
So it had a very long career. About 20 years ago, I was diagnosed with a chronic blood disorder called polycythemia vera. It's part in the disease category of myeloproliferative neoplasms. And I was just being monitored for it. There was no cure, but I was being monitored, but I was able to live a very sort of normal, productive life. I was able to have children and work full time until my health crashed because my disease converted to what's called myelofibrosis, where you don't have enough blood in your system and your bone marrow dries up. And the only cure is a stem cell transplant. And early on in the progression of my disease, my doctors really tried to push me have the stem cell transplant sooner than later because you're younger, it'll be better. But my kids were still in high school, needed to apply to college. And the internet was saying that the chances of survival were only 30%. And so I waited and unknowingly waited till the last minute until my health crashed. I needed to leave work. I was on some bridge therapy for a while until they could find a donor for me because I didn't have a family donor available. And 5.5 years ago, I had the stem cell transplant, and happy to say that my recovery is going fairly well. But after about 2 years into my recovery, I started feeling better. I mentally started waking up. And my doctor said to me, so this was the hematologist oncologist who was really shepherding my care. And she went to introduce me to somebody and said, I want you to meet Dana. She's one of my best patients. And I said, means my health? I'm doing really well. And she said, no, I didn't mean that. I meant you come to every appointment so prepared. You ask good questions. You have good follow-up. You remind me of things. You do such a good job as a patient. And I said, doesn't everybody do that? And she said, no, not everybody does that. So it just inspired me to think about, what do I know that other people don't know? What am I doing that other people aren't doing? But as part of that, I did a lot of research as well. I read everybody's books. I bought books. I read them. I did my own research, all the scholarly research that's happening all over the country that's been happening for 50 years. Researchers studying physician-patient communication and how that affects health outcomes. And I just was so drawn to it. I was very I thought, okay, I think I found a path where I could make all my experiences, both my professional experiences and my personal experiences, come together. And instead of just writing a book, because when you're in a health crisis, your first thought isn't to go to Barnes & Noble to buy a book to help you through the healthcare process. So I decided to develop really resources and a framework for people to use that was pretty straightforward, that people would remember, and they would think about these things. So I called my sort of small consulting company The Thinking Patient, because being sick or thinking about being sick, whether it's something that happens once in a while or you're subject to a chronic disease, is a very emotional, anxiety-provoking condition. Nobody likes to be sick. Nobody likes to see a doctor if they don't really have to. But even when they do have to, it's a really nerve-wracking, overwhelming situation. And I certainly found that with my disease. And I was plugged into the system. But it's so overwhelming. I thought, if I could create tools for people and help people develop their skills, then the anxiety could be lessened, because they could have a stronger pathway to then have a visit with a doctor, to make the most of limited appointment times, so that the doctor could then say, oh, this patient really has prepared for this appointment, and the doctor will respond enthusiastically to a patient's need to know and also a patient's desire to participate in their care. And if you don't ask doctor questions, then the doctor will assume that you don't have any questions, you understand everything. But that's hardly ever, and I don't care what level of ability somebody is. It's very hard for people to come into that room. You need to prepare, you need to do the work, you need to have the skills. And I just wanted to make it easier by laying out some fundamental concepts and also skills and strategies to help people.
Sure. I think that's great. I think I always appreciate, and patients feel like they're bothering me when they sheepishly bring out a sheet of questions or their files or whatever it is. And I'm always grateful for it, because I feel that the appointment, we get much more done and much more addressed than, if they don't come in. And as you know, as we all get older, we don't remember everything, right? And you're in a doctor's office and you feel nervous and you're like, oh my God, what was I supposed to ask? I don't remember. All sorts of stuff happens to everyone, not just you, not just me, a lot of people. So I always say it's better to come prepared, even if it's a question that you think is stupid. There is no such question that's stupid, right? It's important. If you have a question, then it should be addressed. And the other thing I also welcome is family members, because not only do I realize that the patient is cared for and supported, but there's an investment there. Family cares, right? And if they come with questions, I'm always happy to address those questions, because then I know that appointment is going to be made. That CAT scan is going to be scheduled, especially when I emphasize, like, this is the time that I want, the timeline in which I would like things done.
Are you a woman with big financial dreams but no idea how to reach them? You'll love working with Dr. Annie Cole, a money coach who's on a mission to help women earn more, build wealth, and retire early. In her 20s, Annie was a burnt-out social worker, struggling on a $26,000 salary. By her 30s, she had climbed the ladder to a vice president role, invested over $350,000, owned $1 million in real estate, and cut 20 years off of her retirement date. She now runs her own coaching business, Money Essentials for Women, and inspires women to step into new levels of money mastery and confidence. Ready to see how Annie can help you? Set up a free financial consultation at www.money-essential.com/coaching. While you're exploring her services, grab a copy of her new book, 101 Ways to Build Wealth, at money-essentials.com/book.
So give us an idea of what you have your consulting company, how you have supported patients. Give us some examples of how patients have benefited from that.
Okay, so I have been doing workshops and presentations on first having people understand what the dynamic is between being a patient and being a doctor. And the two really have more in common than patients would normally think. So I start by trying to give them a really good idea of what the doctor's perspective is when a patient walks through the room. And then juxtapose that to what the patient feels and what the patient is feeling. And there really is such an alignment between the two. And when you understand that, then a patient or a patient's family member, caregiver, can come to this appointment with really a clear set of what their priorities are, what they want to accomplish, what they want to share with the doctor. And so how I share my framework is really starting with, there are 5 parts. I break it into 5 parts. First part is preparation. So that before the appointment, and for certain specialists, or if you're having an annual visit, it's not just the day of the appointment. Is keep a notebook. It doesn't matter how structured or what the notebook looks like, but everything being all together. To keep a notebook, so as you think of things or you're doing research or you've met other doctors, you're taking really that inventory of what you want to accomplish when you see the doctor, what questions you want to ask, and maybe some research you've done on your subject matter. In addition to being able to ask the doctor, I'd like to clarify my diagnosis, or I'd like to go over my test results from an appointment from 3 months ago. So you are prepared. And most people don't come in, as you had mentioned, they don't come in with things written down. But it's been shown that when you write things down, you also remember them better. You write them down, so when you're engaged in the discussion, you can focus on the discussion and new information that the doctor brings up, so you can ask additional questions, so you don't have to worry about whether you forgot something. So really honing in on some basic skills, and the writing things down by hand also improves, these are other studies, proves the connection between the remembering things. You write things down, you remember them better. You might not even, if you focused, whether it's weeks or just days before your appointment, and you've created this list, because you've written it down, it's been yours, you probably wouldn't even have to refer to it that much when you have this discussion with the doctor. And then it also becomes the record of that appointment, what we covered in this appointment, what the doctor's responses to my questions have been. And I go to appointments, and before I even created my own sort of, I call it the thinking patient planner, that includes space for 30 appointments and other resources and information to make a handy dandy guide for people to use. But you don't really even need that as long as you have a dedicated notebook and that you have space for the doctor you saw, the date, what your priorities, your agenda, your questions, the research that you've done. And then you're able to also look back. I had a very complicated disease, and I wanted to track. I know my doctor was extremely busy, and I had so much respect for her and what she did, but I couldn't expect her to remember everything. And she would say to me, like 3 months, okay, I don't need to do a bone marrow biopsy now, but maybe we'll look at it in 3 months. So here I am at my appointment 3 months later, and I have that note because I'm looking back and seeing what we do with the last appointment and what are we going to do with this appointment. And I took note that, last appointment you said, because really the way that electronic medical records work and doctors note-taking during appointments and then after appointments, and perhaps you want to even speak about that, how intense the information is, that you can't expect your doctor will not do a complete record of what happened in terms of the discussion. It won't be in the medical record. Most doctors I've met have amazing memories. I'm just bowled over the things that my doctor remembers from even 5 years ago about my life. And I will tell the doctor, she goes, I remember that's what happened, and that's why I recommended that. And she will remember. And I just bowled over. In my best days, I never had that kind of memory. So for me, writing things down was a great tool to be able to also be in charge of your own information. And, that preparation phase is just so important. And it's not a hard concept for people to understand, but it keeps getting them reaching and closer and closer to having more control and understanding of their own healthcare information and being able for them to be ready to have the conversation with the doctor.
Absolutely, absolutely. I think there's so much, as you know, that is happening in healthcare. Primary care shortages, and it's very difficult to get appointments with specialists, and there's a nursing shortage. I just did a podcast a couple of weeks ago about empowering a new generation of nurses and what they're trying to do different, because apparently nurses are quitting. Like in the same amount of period it took for them to become nurses, they're quitting in that same time period. So all that investment of becoming a nurse, it's not fruitful, apparently. And I think my generation is different, but I'm reading articles about all sorts of things of how doctors are also in medicine, which is really sad and actually very scary. And the reason why I'm saying this is because I'm trying to highlight that there is so much in medicine that patients are not aware of. And honestly, how can they be, right? It unless you're in the thick of it, right? It's really hard to understand what's going on. But all these things that are happening that are causing shortages, that are putting pressure on doctors and nurses, it is also putting a crunch on time, right? Because that is one last person to answer a patient question. It's one last person to see a patient, right? Because again, if you have less doctors and less nurses, the wait time for patients are going to be longer. So it's even more important, I feel, to be organized and to be prepared for when you finally get that appointment, so that time doesn't get wasted.